I just want to share with you some statistics that we've done. We are a global healthcare provider information aggregator, and we talk to a lot of physicians, nurses, physician's assistants. I want you to take a look at how many nurses and doctors own smartphones, tablets, and have a desktop computer. They almost all do, don't they? This is our answer. Highway. And we need to do that first by looking at communication. And that means patient to healthcare professional. So I told you, we almost all of us nurses and doctors, we've got smartphones. Let patients call us and talk to us. We need to make sure that if I'm here in New York talking to my patients, or talking to you, if one of my patients has a question back where I practice, that they have the ability to call me, guys. All right, good. I want to show you what reality is. So today's reality, we have a system called the Da Vinci system. The Da Vinci system is a robot that does the surgery for you. The surgeon actually sits here at a console. The machine is doing the surgery. So in my role as chief nurse of Ultrasport Health, I actually travel to a lot of different countries and help them devise methods to improve the healthcare within their countries. So I actually do a lot of this. And in some countries I start very, very basic with looking at how to improve their clean water and get access to food. But when I travel around the world, almost everybody has a smartphone. And it's really about getting access to the best healthcare information on a smartphone is really a great place to start. So that's one of the things I really work with them with, and make sure that they have access to information that can be really used and used on smaller devices. You don't need to have a computer, you need to have a computer in your hand. Thank you. I think the world is in a healthcare crisis, and it's because we have not invested our resources in the right things. We have, in countries that have insurance, everything's put into the insurance system. If you'd be able to break down and stop charging these enormous rates for a blood test or a drug, that would be one place to start. When I go to Africa and the people don't even have access to clean water, that's a problem. And we need to really invest in that. So I think it's about moving our money where it's going to make the most effect. And as I've said before in my slides, we have to really look at clean water, access to food, proper plumbing. If we don't solve those issues around the world and make it equal, you're always going to be dealing with disease. You're not going to make any advances at all. I would say there is a lot of money going into pharmaceutical development right now. A lot. In some countries more so than others. The problem is that we need to look at disease prevention, and disease prevention is not done with a pill. It's done by lifestyle changes. So diet, exercise, that type of thing, stopping smoking. I do think that more money has to go into the right type of drug development. We need to do more work around vaccines and around drug development related to DNA. It's called pharmacogenomics. We're specific to each individual people, and their DNA makeup. I think that's where the future is really going to be, and we need to invest in that type of technology and drug development.